Hi friends, my name is Jeremiah. Thanks for joining me on today's webinar. I'm the Chief Marketing Officer at Regenerative Medicine here in North Kansas City. Today we're going to be talking about mental fog. We're going to be talking about stiff joints, painful, tingling, that type of thing in your joints. And we're also going to be talking about just changes in organs and how regenerative medicine may help with that. Dr. Bruce is going to be joining me here in a minute, and I'll catch you at the back end. Hi friends, Jeremiah with Dr. Bruce. We're at Bridge Integrative Medicine today in North Kansas City. We're talking about regenerative medicine. I get a lot of people that ask about basically three types of symptoms. One is going to be the pain and the tender points, the stiff joints, that type of thing. The second set of symptoms are more mental, with the mental fog, fatigue. You get some anxiety, things like that, sleep problems. And then there's a whole subset of just other things where you have changes in bowel, you have changes in bladder, and then headaches. Those really are the three different symptom categories I get when we talk about regenerative medicine. Can regenerative medicine help with any of those?
Yeah, all of them actually. What we use here is designed to help you I like to say it rewrites the code, but what regenerative medicine actually does is sings the first 4 bars of a really good song, and the body then takes in that regenerative medicine and takes the microRNA, changes how those cells react to certain situations. And so in your pain points,
right,
like your tenderness, you've got joint pain, it's very stiff, it has all of that, that gives off a signal, and the body will then is in fact trying to solve that problem. Some of that problem is solved by pain, heat, redness, and swelling. So actually the pain, the tender joints, the numbness you get and tingling, all of those are signals designed to draw attention to something that needs healing or growth in the body. And the regenerative medicine knows that we use and will seek out those areas.
Yeah, so it's the same thing with like you're talking about the cell signaling and the body sensing things. Same thing with the sleep problems and fatigue and anxiety.
Absolutely.
There's a cell signal that's going on that the regenerative medicine can help with.
Exactly. So something's going on. That's happened, and we know that. Your brain, you actually are aware that something is wrong because the signal gets to the cortex. But the body knew something was wrong likely long before you did. And when you put something in the body that's designed to regenerate it, it will cross the blood-brain barrier if appropriate, and it will actually start to rewrite the code to a different secretory profile, different set of cells. Absolutely. Yeah, regenerative medicine is actually designed for those things that feel like aging. Because aging is not yet a disease, we can say that, but it really is. It's like, well, that's just normal. It's because I've gotten older, I don't sleep well anymore, or I've noticed a change in headaches, or I've noticed a change in bowel and bladder and all of that stuff. And actually, your body's producing a chemistry that's asking for help there that sometimes gets in its own way. Inflammation is one of those. Body heals with pain, heat, redness, and swelling. That's how it heals and grows. The problem is it can be stuck in that loop and never recover. Regenerative medicine solves some of that and then rewrites the code so that it can calm back down. You're going to constantly get a stimulus from your environment that is going to change your, unfortunately, you can tell by the wrinkles I have under my eyes, right? I've been out in the sun, my environment changed me some. Right? Why do we wear glasses? You didn't need glasses when you were 10. Maybe you did. I don't know. Did you?
Yeah.
I didn't need glasses till I was 30. But you get the point, right?
6.
Were you really?
Yeah, I was young.
But you would think that what a strange thing that the environment would change that or cause that for us. But that's what's happened. A strange environment or a different environment somehow caused your body to constantly ask for help. And that's what symptoms really are. It's an ask for help. Regenerative medicine goes and finds that signal and changes what's actually wrong at the cellular level.
So someone who's looking to maybe manage symptoms a little better, they're looking for improving their quality of life. Regenerative medicine would be maybe an answer to that question.
You have to find out if you're a candidate first, but if you're a candidate for this, it really is impressive. It really is. So there's a lot to go through, and I know you have the right numbers and the people to call, but it's worth your time to at least seek it out. It's the cutting edge of medicine at this point.
Thanks for joining Dr. Bruce and I today, and during our discussion. If you're looking for more information and want to have a conversation with one of our providers, we can do a free virtual consult with you. It's just 10 minutes with one of our providers just to get some more information to see if you're a candidate for our program. Our phone number is 816-454-5433, or Dr. Bennett will be contacting you after this webinar by email to get your information. We hope to see you soon.